When a couple struggles to conceive, the cultural spotlight typically falls on the woman. Medical evaluations often start there, operating on the silent assumption that her reproductive health is the primary variable in the equation. Clinical data reveals a different reality. Male biological factors account for nearly half of all infertility cases. This condition frequently operates without warning. A man can maintain peak physical fitness and experience no pain while his internal systems are failing to function. At a cellular level, these failures occur in three specific areas: the total count of sperm produced, the efficiency of their movement, or the physical cell structure. Successful fertilization requires millions of cells to survive a grueling journey through a hostile environment. If those cells are too few, too slow, or misshapen, the journey ends before reaching the target. To resolve these microscopic failures, medical science traces the biological assembly line from the brain down to the reproductive tract, pinpointing exactly where the process has stalled. The production process begins in the brain, specifically within the hypothalamus and the pituitary gland. These structures release specific hormonal signals that travel through the bloodstream down to the testes, triggering sperm production. However, systemic health issues like obesity, diabetes, or stress can cause these signals to misfire or fade before reaching their destination. External factors also disrupt this pathway. When a man takes synthetic testosterone or anabolic steroids, the brain detects the surplus and shuts down its natural signal production entirely. Doctors manage these signaling failures through targeted hormone therapy. These medications can restart the brain's natural communication without suppressing internal production. However, even with clear instructions from the brain, the system can still fail if the physical site where cells are constructed is compromised. The hormone signals terminate in the testes, the site where sperm cells are physically assembled. In some cases, the production lines are stalled by genetic, chromosomal conditions. These act as flawed blueprints that prevent the tissue from building cells, regardless of the signals it receives. A more common and reversible physical threat is a varicocele, a condition involving the abnormal enlargement of the veins within the scrotum. The testes are located outside the body cavity because sperm development requires a strictly regulated environment that is cooler than core body temperature. A varicocele pools blood, transferring core heat directly to the testes and degrading sperm quality. Surgeons resolve this by performing a varicocelectomy. Sealing abnormal veins allows the localized temperature to drop so healthy production can resume. For patients with genetic blueprint errors, advanced testing allows specialists to identify the specific chromosomal flaw and evaluate if assisted reproduction remains a viable path. But creating healthy sperm is only effective if those cells can successfully leave the body and complete their mission. Once built, sperm enter the vas deferens, the narrow duct system they must travel to exit the body. This path is easily obstructed. Past infections, certain diseases, or anatomical scarring can create physical roadblocks within these tubes. This leads to azoospermia, a condition where healthy sperm are being produced in the testes, but the ejaculated semen contains none at all. The healthy cells remain trapped behind a permanent barrier, unable to reach their destination despite being fully functional. Doctors can bypass these blockages through surgical repair or by using clinical retrieval techniques to collect viable sperm directly from the source. While internal structural failures are common, the most rapidly accelerating threat to fertility originates from the environment around us. Moving from microscopic anatomy to global population data reveals a compounding trend in modern health. Average sperm counts have been steadily declining across the globe for several decades. Research links this trend to modern lifestyle habits. Chemical exposure from smoking, for example, physically breaks down and fragments sperm DNA. Compounded by a lack of sleep, heavy industrial pollution, and excessive heat exposure, all of which create systemic internal inflammation that degrades reproductive quality. Understanding these biological and environmental mechanisms changes the way we approach infertility. Because these challenges are rooted in specific physiological systems, they are diagnosable medical conditions. Reframing the issue as a clinical system failure allows for more effective testing and targeted treatment. The evidence suggests that if conception hasn't occurred after 12 months, a simultaneous evaluation of both partners is the only way to ensure the invisible half of the equation is finally addressed.